Hello, I'm Dr. Charles Gardner, Professor of Health with the Simcoe Muskoka District Health Unit, here to provide you with the COVID-19 update for Simcoe Muskoka. So at this point, we have 2,462 cases. And if I look over recent weeks to give a sense of perspective, the week up until Saturday, the week of the 29th of November, we had 230 cases in the week, whereas from Sunday onward in this week, we have 215. So we're definitely on an upward trajectory. The week before all of that, the week of November the 22nd, we had 183 cases. So definitely continuing to go up in cases. I also regret to inform you that we've had an additional death since I last reported on December the 3rd. We had a male between the ages of 18 and 34 pass away. I express my condolences for the family for your loss. And this certainly is a young individual who's passed away as well. The details of that case are still under investigation. That individual lived in Simcoe County. So if we look at the cases that we've had over the weekend and on Monday, we've had a total of 215 through the weekend, and of the last 48 cases that occurred in the last 24 hours, 45 of them were sporadic cases, one from a congregate setting, 23 males, 23 females, ages from the teens through the 70s, 41 of them living in Simcoe County, 2 in Muskoka and 3 unknown at this time. One of them was a community-acquired case. One was a close contact. 43 were under investigation. One lived in a congregate setting as part of an outbreak. All are in self-isolation. We have a total of 349 active cases at this time and 2,047 that have recovered. Presently, we've, in our data system, had 10 hospital cases, people between the ages of 40 and in their 90s. All of them are from Simcoe County. 3 of them are in the intensive care unit. 7 of them are in RVH, 3 of those 7 in the intensive care unit, 1 at South Lake, 1 at Stevenson Memorial Hospital, and 1 in Mount Sinai. But we also know of some additional cases that have yet to be put into our information system. We know of 6 cases acquired in the community, admitted at Collingwood General Marine Hospital. And 1 individual that is presently in the intensive care unit has been transferred to Mount Sinai Hospital. We have a total of 16 active outbreaks at this time. 4 are in institutions. So 1 is at Simcoe Manor, 1 is at Georgian Bay General Hospital, 1 at Mill Creek Care Center, and 1 at the Waterford Retirement Residence. And in the past 2 weeks, since I last reported, we had 4 outbreaks declared over: Allendale Station Retirement Home, Simcoe Manor, Sunset Manor, and Holland Gardens Retirement Residence. We have 3 outbreaks in congregate settings, all of them in group homes in Simcoe County, and then we have 3 others that were declared over. 1 a congregate living center in Simcoe County, 1 a group home in Simcoe County, and a second one in a group home in Simcoe County. So a total of 2 group homes in Simcoe County. We have 3 workplaces in outbreak right now. One, an essential service, one a distribution center, and one a retail facility, all of them in Barrie. And we have 4 outbreaks in workplaces that are declared over. One a manufacturing center in Simcoe County, one a food services center in Simcoe County, one a physician's office in Simcoe County, and one a public administration location in Simcoe County. We have 5 educational settings that are in outbreak right now. 3 of them in secondary schools and 2 of them in elementary schools. In the secondary schools, Bradford District Secondary School, Banting Memorial High School, and Nantour Shores Secondary School. And for the elementary schools, Steele Street Public School and Portage View Public School. And since I last reported, we've had 4 outbreaks in schools, educational centers declared over. One in Warnica Public School, one Willowdale Landing Elementary School, one Nottawasaga Pines Secondary School, and St. Joan of Arc Catholic Secondary School. We've had an outbreak in a community setting in a religious organization. A church in Simcoe County declared over, but we'll be removing from our website tomorrow. And then we have 2 other locations that have been declared over since I last reported. One a hockey team in Barrie, and one a fitness and recreational sports center in Simcoe County. So we continue very much to see clusters and households and families, including large family gatherings, multi-generational households. People cluster very much in South Simcoe, Barrie, but other locations as well as in Simcoe, much more so than in Muskoka. And travel to the Greater Toronto Area has been a factor with regards to work. People being part of outbreaks at work and then inadvertently bringing it to their home. And also people socializing beyond their immediate household, including in the Greater Toronto Area. So I repeat my message. It's really important that people stick to their household for close contact, that you maintain physical distancing from other people. Encountering people outdoors is definitely safer than indoors. For those who are in a red zone or a gray zone, you're not to be having people over at all in your household, in your home. So far, we are still in orange in Simcoe, Muskoka. And of course, there are the other control measures as well, wearing face coverings when in indoor public settings or work settings, or if you're outdoors and cannot physically distance, hand hygiene, self-monitoring if you develop any symptoms, self-isolation and seeking assessment and testing. And doing so expeditiously, not waiting on that. Part of what we've seen about transmission in households is people who've waited some time after the symptoms begin before they go and get assessed, allowing, unfortunately, transmission to occur with more exposure to those in the household. So if you develop symptoms, isolate yourself from others in the household and go and get assessed right away. If we look at our school situation, to date, we've had 144 cases of individuals in schools, but we've had only 12 outbreaks declared in schools, 6 of them in secondary schools, 6 of them in elementary schools. So the great majority of those exposures did not result in transmissions, and speaks to the importance of the control measures that are in place to contain and reduce transmission in schools. It's also really important that people screen their children before they go to school and not send them to school with any symptoms of COVID-19. If we look at our dashboard on our website, the dashboard that we have for ourselves, not the province's framework, but our own dashboard, we've now moved into categorization of red. And the reason for that is we've had some deterioration. Certainly we continue on with an increase in case count, and we continue on with an elevation of the total number of outbreaks that are happening. Our reproductive number is up to 1.6. It had been 1.3. Anything above 1 indicates that we're continuing to grow locally with regards to the pandemic. We want it below 1 in order to be having it coming under control and shrinking. We have had some slowdown in the turnaround time of our lab results, and also our percent positivity result has gone up to 2.1. So percent positivity is an indication of how much transmission is happening in the community compared with how much testing are we doing. And it's one of the indicators of the degree to which the pandemic is growing, how much transmission is happening. And so we're up to 2.1, and previously, when I last reported, we were at 1.5. Our health system capacity remains unchanged in a category of yellow, although we've had more cases admitted to hospital. The numbers are still relatively low, so they aren't presenting an excessive challenge to our system. But our hospitals are well utilized at this time for other reasons, so hence the yellow category. And as a health unit, we're challenged right now with case and contact follow-up. We're having a harder time getting to our cases and being able to assess them, and same with the contacts. We've changed our system so that we have a rapid response process to try and get to all of our cases, to at least ensure that they are isolating and not going out into the community or not exposing other people. So we have a dedicated team now for that purpose to speed that up, but otherwise we lag in our ability to get back and get a lot more detail about our cases, and same with the contacts. That would be a function of just the volume of cases and the volume of contacts that we have at this time. We're bringing on more staff, we're increasing the number of contacts that we're referring to Public Health Ontario to address, and we're also approaching the province to be able to tap into additional human resources that they would have for us to help us correct this particular challenge. So if you look at the trajectory for ourselves and we express our cases in terms of a rate, we're up to 45.4 cases per 100,000 population over the last week. This compares with 33.0% the week before. Also to be compared with the province's rate in the past week of 84.8. So we still remain now a little bit above half of the provincial rate. But it's important to note that the province's framework with its color coding would note the designation of red if you actually have an incidence of above 40. There are other indicators as well on that framework that we don't yet meet, but I think this is a warning to us that if we don't stabilize and start to bring things back down again, we would be moving towards the possibility of being in the red category at some point in the future. Our growth rate of cases is 1.8% per day, which is up from 1.4% last week. Our doubling time has decreased to 41.8 days. So if we continue to grow at the rate we have now, we'll have double the cases that we have now in 41.8 days. just going to move on and talk about our outbreaks in a little bit more detail. With regards to our institutional outbreaks, Simcoe Manor had been an outbreak and then ceased to be an outbreak, and now they have a new outbreak, but it is of a single staff case. This was declared on November the 29th. Testing has been conducted widely in the facility with negative results and some results pending. At this point, there's no evidence of any further transmission. Georgian Bay General Hospital in Midland, the hospital itself has certainly posted good information on their website about their outbreak, the extent of it, the number of staff, and patients that are involved, and also the wards that are affected. By our data, they have 11 staff have been positive and 1 positive patient. They are continuing with their control measures and their testing of all who've been exposed in this situation. And we are working closely with them in the management of this situation. Mill Creek Care Center in Barrie commenced an outbreak declared on December the 6th. They have 1 positive staff member, no known positive residents, and have had testing done by the residents, and we are awaiting test results on the residents and on the staff. Waterford Retirement Residence in Barrie had an outbreak in the past and then recovered, and now has another outbreak commencing December the 6th with a single staff case and no known resident cases. Testing was commenced yesterday, and we are awaiting results. With regards to our educational facilities, in outbreak, Bradford District High School has 4 positive cases, and I know that in the past I have reported how that breaks down with regards to students versus staff, but we have encountered the potential when we've indicated staff numbers, given that staff are a smaller number of people to begin with, there's a potential for individuals to be identified. So from this point forward, we're not going to be breaking that down. We're going to be keeping the numbers simply as a whole for staff and for the students combined. So in that school, they've had 4 positive cases. Steele Street Public School in Barrie, outbreak declared on December the 1st, and they have 3 positive cases. Banting Memorial High School, outbreak declared on December the 3rd, and we have 4 positive cases. And Nanter Shores Secondary School, outbreak declared on December the 3rd, and we have 5 positive cases. Portage View Public School declared on December the 3rd, and we have 4 positive cases. If we look at our congregate settings, a group home in Simcoe County, outbreak declared on November the 30th, with a total of 35 confirmed positive cases. So 21 of these are staff and 14 are residents. We've otherwise conducted testing for the staff and the residents, and they've come back as negative. An outbreak in Simcoe County declared on December the 2nd, with 1 positive staff member, and otherwise on-site testing completed for staff and residents with results pending. We have a group home in Simcoe County, outbreak declared on December the 7th, with 1 positive staff member, and otherwise investigation continuing. With regards to our community setting outbreaks, one church in Barrie was declared on December the 1st, but declared over on December the 7th, and will be removed from our health stats page. This had a total of 5 cases. With regards to our workplace outbreaks, we've had, at the moment, we have 3. One is an essential services location in Barrie, which was declared on December the 1st with 3 staff and testing of all on the premises. We have a retail location in Barrie, which was declared on December the 2nd with 2 positive staff, and we have a corporation in Barrie declared on December the 4th with 8 positive staff, otherwise investigation continuing on that premise. So just a few follow-ups. On our website now, we have under health stats some information about cases by sociodemographic characteristics, and in addition to a breakdown of age and gender, we have information about language, first language, and also ethnicity. And what we found, in keeping with other parts of the province and elsewhere in the world, is that there's a clustering of cases among people who are visible minorities or belong to ethnically diverse neighborhoods. So visible minorities in Simcoe, Muskoka make up 7% of our population, but make up 50% of our cases. In terms of individuals who report a language other than English or French as their mother tongue, they make up 10% of our population, but 43% of our cases. Unlike the data that has been noted elsewhere in the province, though, we do find that the cases are more likely to occur among those of higher income or people who are moderately or well-resourced. So this is actually the opposite of what has been found elsewhere in Ontario. As I've indicated, we continue with outbreaks in many settings, including workplace settings. So it's really important that employers and employees practice the requirements now that I've communicated in a letter of instruction to safeguard their work environment and reduce the likelihood of them transmitting COVID-19 or being part of an outbreak. So this includes self-screening, active screening before they come to, sorry, I'm hearing typing on the line, so just a reminder to mute your line, please. Thank you. So anyway, screening is required now. Actually, all of this was a requirement under regulation that was enforced under Ministry of Labour, but now is enforceable by the health unit, by police, by bylaw officers as well, because of my letter of instruction. And distancing, face mask use, hand sanitization, care with regards to travel together in vehicles, preferably that people not carpool at this time, and if so, they need to be masking and distancing within the vehicle with air exchange in the vehicle. All of those things are really important to avoid transmission in the work environment. We've seen lots of transmission in the work environment. People can let down their guard during lunch, and that can be an issue. So people can also find themselves socializing with the people they work with, and that can be an issue. So you need to keep up your guard at all times. You can't let it down. We routinely will get questions about why don't we name businesses with cases or are part of outbreaks. And the answer that I give is that we provide information to protect people So if people are part of an outbreak, we directly approach them to inform them of this and have them take the actions necessary to prevent spread from them to others. And most of the time we can get the names of individuals and follow up and manage that situation. And we provide the names of facilities if that's not the case. If we find that there's been exposures to the public and there's no way that we can identify who's been exposed, then we will go public. We'll certainly go public with the name of a facility if they go public with their name, if they choose to do that. And we use and provide the names of public institutions such as schools and healthcare facilities. But otherwise, we protect the names of businesses to avoid causing harm. We are always seeking to protect the public while avoiding causing harm. And certainly we protect the identity of individuals and their privacy. Holidays are coming up. This is the holiday season. It's really important that people view this as not at all a normal year, and that we need to put on hold the usual kinds of gatherings that we do, and instead to stick to your household and otherwise keep physical distancing from other people and limit your contact with other people, because we are seeing a rise at this time going into the holiday season of COVID-19. It's not at all under control. We know from our experience with Thanksgiving that gatherings of this nature lead to more transmission, and certainly the very last thing you would want is for a gathering in your household to result in transmission, making family members or loved ones, friends and others seriously ill, or causing them to transmit to others. So we've all got to be part of the solution. And I'm really asking for people to exercise restraint and to connect with people remotely instead. An exception I would make is for people who live alone. I always encourage such people to adopt one other household so that you won't be utterly alone. But beyond that, we need to be sticking to our household for close contact. And if we end up in the red zone, the province's recommendation, strong recommendation, is that you not only are you sticking to your household for close contact, but that you not have anybody over at all. So it may very well be that in the future we would move into the red zone, and then that is that much more of a stringent requirement. It's also recommended that people not travel between the colored zones. So going from here to a red or gray zone, or people from a red or gray zone coming here, except for essential purposes such as work. So I'm really recommending that people abide by that as well. We have more documents on our website providing guidance to businesses and organizations about how to operate being in the orange zone, orange district. So please have a look at those resources. And we are preparing ourselves to be ready with documents if and when we end up in the red zone. There is much excitement about the coming COVID vaccines, and rightly so. I personally am very much looking forward to their arrival. We note that in Britain they have commenced with vaccination, and we see a lot of media reporting and announcements from our political leaders about this being imminent and impending in Ontario and Canada as well. So as a health unit, we're getting ready for this. We are in discussion with partners, including Royal Victoria Health Centre, for the potential to provide vaccine. These vaccines, the ones that will come out at the very beginning, have stringent requirements for their storage, ultra-cold freezing requirements that necessitate a special type of freezer units. And so we are going to need to work in partnership to be able to play our part in the distribution, and we also wait for more and clear direction from the province about exactly what their expectations are of us in the provision of vaccine. But given that it is a very much tradition of public health to be providing leadership on vaccination as one of our core functions, I fully anticipate that we will have a strong leadership role. So a few questions that have come from the media are as follows. Can you explain how COVID-19 outbreaks in schools are being handled when an outbreak occurs? What is the health unit response and school response, and how well is that working? So we, as I indicated, we've had 144 cases to date, but only 12 outbreaks. So transmission is limited despite the large number of cases that have ended up in schools. Those cases have been from community transmission or household transmission and then ending up with exposures in the schools. But we are notified of all laboratory positive test results. We follow up with all of the cases. We identify what contacts they've had. By that means, we end up identifying either staff or students who've been in the school environment, and then we investigate who their contacts are, what their cohorts are, and provide them with written communication through the school in question to have them quarantine, have them isolate to avoid further transmission. So all of those cases have resulted in isolation of classes, cohorts of students and staff in order to avoid further transmission. It's a lot of work. It certainly requires a lot of partnership with the schools and the school boards to do well. To date, I would say that we've been successful, schools have been successful in reducing and minimizing the amount of transmission that's been happening. Despite the potential for it, the amount of transmission has actually been very limited. And certainly we're fully committed to keeping schools open because of their importance for the well-being of children and the well-being of families as well, enabling people to be back at work. Another question. Students are supposed to stay in their cohorts to prevent spread. Are they? Is this working? Are you seeing outbreaks spread beyond cohorts in the same school? So like I've said, we've had much more exposure than we've seen transmission, and the numbers of cases in schools with those outbreaks has been limited in size, and according to the information that I have, confined to the contacts, confined to the cohorts. Sometimes it can be the potential for more than one cohort. They can have a class, and then if they're traveling by bus, there can be some exposures there as well. So you can have more than one cohort. That's a function of the details of the situation, but so far the containment has worked. Would you suggest a longer winter break for schools as a way of preventing the spread of COVID-19 during or after the holidays? What amount of influence do you have in making this decision in our area? So I would say that I think it's appropriate and best that students return to school after the holidays without an extension of a break. The reason for this is that with a further extension of a break, they would lose out on school time, and they would continue with the potential for home exposure. So extending out the time wouldn't detract from that, wouldn't limit that. It would just extend into a longer period of time. We've had good experience so far in containing spread or avoiding spread in schools. And so back to the commitment of having students get a full education and get the positive health and mental health benefits of being in school. Certainly we're emphasizing that people stick to their cohorts over the holiday season. That's important for everybody's well-being, for the protection of vulnerable populations, older people, people with medical conditions, and for flattening of the curve and helping to bring the pandemic in Simcoe, Muskoka back under control. Will police or bylaw officers give tickets to people who will receive visitors during the holidays? So it's our recommendation, our strong recommendation, that people not receive visitors over the holidays, or if they do, that they physically distance from them. And certainly they're required to limit gatherings, indoor gatherings, to 10 people or less. So the requirement is to limit the gathering for 10 or less. The strong advice is that they physically distance and stick to their household for close contact. But there wouldn't be issuing tickets against people who aren't following the advice. There's potential for tickets, fines to be issued for individuals that have broken the gathering limit of 10, but not people who aren't abiding by the advice. If we end up in the red zone, then the advice becomes stricter. It's that people not have any visitors over at all, and the requirement is that there be public gatherings of no greater than 5 for indoor gatherings. In addition to physically distancing outdoor walks, I'll do that again. In addition to physically distanced outdoor walks and telephone or video talks with friends and family, what other physical and mental health activities or advice can you recommend to help people cope with isolation this winter? Well, I would first off acknowledge that this is hard on us all. This isolation is hard on us. It's one of the reasons why it's so hard for people to abide by it, why it's so hard for us to get compliance. And I believe that most people take this very seriously and work hard to abide by it, but it's still hard on us. I would really urge people who live alone to adopt a household to be part of, so that you aren't utterly alone. I think that's a dangerous situation. I certainly would advise people to do the kinds of things that are embedded in the question. So having remote communication with people, and staying in touch with people, I think, is really important. Making the most of your social contact within your household would be very important. And indeed, getting out for physical activity and fresh air would be very important as well. And otherwise, take good care of yourselves. As we always say, you should be striving to have a healthy diet, moderation about alcohol use, not using tobacco or other harmful substances. So we know that there's been an increase in alcohol consumption, according to reports, and potentially cannabis as well. So that, I think, might be an indication of how hard this is on people. And I would say that people should reach out and use the services, mental health and health services, that will remain open and available even if we end up in a lockdown situation. They will remain available. There have been 2 Barrie Transit drivers confirmed as COVID cases at least a week ago. How big is the risk? How big a risk does it present? So I would confirm this, and the City of Barrie has communicated about this in writing. We expect, with the amount of transmission happening in the community, that that will occur among all walks of life, including transit operators. And therefore, it's really important that we have the control measures in place for them: the plexiglass, the distancing, the mask use, the self-screening. With those measures, and with people, transit users also wearing masks and physically distancing, the risk would be low. What gives you hope for the future these days? So I guess I would have 2 sources of hope. One is that to date, despite the rise in cases, I think we've done much better than we might have done. We could have had anywhere between 20 to 40 times as many cases accumulating to this point if we'd not put in place the measures we did in the spring, or even the measures now. We've not increased our case count at the rate that it appeared to be happening when there were projections done at the beginning of November. So I think there's been some flattening. And I believe that most people take this situation very seriously. So that is certainly a cause of hope for me. Other countries have managed to recover from their second wave. Right now in Europe, the countries of Europe, their counts are coming down again, or come down quite substantially. So if they can do that, it's possible for us to do it, but we're going to have to be very disciplined in order to have that happen. The other source of hope for me is the vaccines that are coming. I think it's marvelous that amazing that we've been able to, in less than a year, produce what appears to be highly effective vaccines that will be starting to roll out early in 2021, if not sooner. We as a public health community are striving to be ready to make that available to the community, because I believe that will be a key intervention to bring this under control and to get ourselves in a place where we can start to live more normal lives again. I know by the numbers that it's going to take perhaps the better part of a year to be able to vaccinate everybody who needs to be vaccinated, at least 70% of the population. But we are going to be commencing with those at highest risk, and that in itself gives me great comfort. If we can provide protection for those who are much more likely to have serious illness and to die from this, then that is an excellent way for us to begin. So at this point, I'd be happy to take questions.
Okay, thank you, Dr. Gardner. Let's start with Erica Engel at Barrie.
Hi, yes, thank you. My question is about you said there were 6 hospitalizations at Collingwood General and Marine. Mm-hmm. Are any of those cases already reported on the case list?
I don't believe they are. We had to draw from our staff who were aware of them, but we had yet to actually get them into our database to get them on our website. So they aren't up there yet.
Okay, and then we have confirmed with Loblaws that there have been 6 death cases at the Collingwood Loblaws. Mm-hmm. I just wondered why there hasn't been a workplace outbreak declared there.
That's still under investigation. We are proceeding with investigation of outbreaks, like our cases, and in good time that'll be up. One of the things I would say is that we are doing our best with the caseload that we have, but it is having an impact on our speed. So while we've committed to a rapid response to reach all of the cases within 24 hours of tests coming to us and to have them in isolation, it's taking us longer now to be able to follow up and thoroughly investigate them and, for that matter, declare some of the outbreaks. So that is having an impact. We are having to prioritize situations to focus the speed with which we pursue things based on the degree of risk of the situation. So certainly outbreaks in a very vulnerable location like a long-term care facilities would be given high priority. Larger outbreaks would be given higher priority. But I think it's important to note that the volume of cases that we have right now is having an impact on us.
Is it also causing delays in when we're getting cases reported? For example, the cases on today's list, were there positive results maybe confirmed a couple of days ago?
It is having that kind of an effect. There is some delay in the processing of the data and getting some data entry. So hence my additional information that I provided about the cases at Collingwood General Marine Hospital. That was cases that were not within our database, but I was aware of, and so I reported them.
Thank you.
You're welcome.
Thank you, Erica. Brett Glover from Barrie 360, are you there?
Yes, I am. Thanks very much. Good afternoon, Doctor. We've heard more than a few anecdotes as recently as even today about some inconsistent messaging when folks are getting tested in Barrie. Some were told to self-isolate until results are ready. Others were told the opposite, that actually self-isolation wasn't even necessary, even though they had close contacts with their own bubble. Are you concerned that there could be some breakdown in key messaging in this massive healthcare machine?
Well, I do appreciate you letting me know that, and I'm going to approach my staff on that and see what else, investigate it further. But we do need consistent messaging, and it needs to be precautionary. People need to be told to wait while they get the results. Now, it may be, it depends on the situation. It may be that those are individuals who are just getting routine testing as a requirement before they do visitation and long-term care, and that they have no symptoms, they've had no contact. So that would be a situation where I would say there's no need for isolation.
I see. And how about long-term care homes when employees are informed of a close contact positive case? Can you walk us through the protocols there, what the facilities' responsibilities might be in that case?
So that would be a situation that would be an outbreak, essentially, because there's a very tight definition for an outbreak in a long-term care facility, a single laboratory confirmed case. And so in that situation, we would be identifying everybody that had been in contact with the individual, whether it's a resident or whether it's a staff. Erring on the side of inclusion, we'd be generally testing the entire facility. There might be instances where there's only a single unit that we would have to do that for, but generally it's the entire facility.
Thank you very much.
You're welcome.
Thank you. Madison Earhart. Sorry, got some feedback there. Madison.
Hi, Dr. Gardner. I was wondering, I know you've mentioned the potential of moving into the red zone quite often this afternoon. How likely is it in the next couple of days, maybe even a week, we could see that?
There's a significant likelihood. There's an even greater likelihood if you look out beyond the week to the next week, given the trajectory. If it doesn't happen in a week, it's much more likely to happen within 2. So if we don't actually flatten the curve and start to come down, then we're at high risk of it.
Okay. And I did talk with the Canada Post Distribution Center on Morrow Road, and they are confirming that there's 10 cases there. Do they say that there is it a low concern to the community? Why would that be with a high number?
So at this point in time, I don't have confirmation of a facility having gone public with such information, and I therefore would decline to comment about that. I'd need to look into and confirm what you've just said. As I'd indicated, we release information for facilities that are public health care and facilities, hospitals, businesses or corporations that have gone public and that I know for sure have gone public. Or we would release the name if there had been members of the public that were put at risk and we weren't able to identify them.
Okay, thank you.
You're welcome.
Thank you, Madison. Chris Simon from the Barrie Advance. Go ahead, please.
Yes, thank you. Hi, Dr. Gardner. Hope you had a good bit of time off.
Thank you.
The province is saying that the vaccine, they may get their first shipments of the vaccine within the next couple of weeks. When do you think that some of that may filter to our region?
Well, the sooner the better, although it would be a challenge for us to immediately be ready to go. We're making our plans now, and we are going to do some more hiring for it, but we would reallocate and respond no matter when it comes. I really don't know for sure, right? I get most of my information is really through the media channels. We've not had a lot of direct communication about details such as that.
And how would you envision healthcare workers first, vulnerable sectors? How do you see distribution going?
Once again, I'd be looking to the province to give us more detail, but we have had direct guidance from the National Advisory Committee on Immunizations that called upon those most vulnerable and those who care for them to get vaccine first. So those that are vulnerable by age or medical condition, those who provide direct care for them, and also Indigenous communities. We've got some real technical challenges in handling the vaccines that will be coming out at the very beginning. So they require deep refrigeration and therefore special handling. And so we would need to become versed in how to do all of that. As I'd indicated, we know of one such deep freezer at RVH and are going to be working in partnership with them. We would need to have a better understanding about the logistics of getting such vaccine to where it would need to be to vaccinate. So if I had my druthers, we'd be able to take it to the long-term care facilities and give it to the residents. But we need a better understanding as to how readily could we do that with a vaccine that has these kinds of strict freezing requirements, and whether or not we'd have to modify that approach so that you're first giving it to people who are more mobile and could come to us in order to receive the vaccine. So we need more detail about that kind of logistics in order to be able to properly answer your question.
Thank you.
Thanks, Chris. Sean Gibson from Barrie today. Go ahead, please.
Hi, thank you. With regards to the two transit drivers, understanding the need for privacy, this is a case where we could probably let public know that they came in direct contact. Why weren't we told the routes? I understand the privacy, but really could have opened it up to a lot of people on who they had contact. Where does that get determined?
So for us, it's a matter of looking at the potential for high-risk contacts. And the high-risk contacts are instances in which people have been within 2 meters of each other without using a barrier or a mask for 15 minutes or more. And we're quite certain that with the physical layout changes in place and the requirements in place in those buses, that would not have happened.
Perfect. And secondly, you said earlier that kids should go right back to school right after the break. I think you were saying mental health was an aspect of that.
Yeah.
The kids need to be in school. With regards to that, when that comes out, if we do go into a red zone or worse, a lot of business. With regards to that, when that comes out, if we do go into a red zone or worse, a lot of businesses will say that they're going to suffer financial health as well. What would you say to that when they say, well, the kids are in school, we can't have people in here? What's your statement to that?
Well, certainly I would acknowledge that it's causing harm. It would cause, these restrictions cause much harm. They cause harm economically to people's livelihood. And they come with a cost. And so we're forever with this pandemic having to trade off costs with imperfect information. We learn more as we go, but it's still imperfect information. We have learned since the first wave that children are far less vulnerable to this virus than adults, or in particular older adults. They're much less likely to transmit it as well. And we've also had some very good research showing from being withheld from school as well. There's been some quantification of that harm. So when it comes to schools and children, we've come to the conclusion that it's best that we manage the risk and have them stay in school. We haven't rushed to close businesses by any means lightly or restrict them. And the province has taken an approach where the restrictions are graded with a degree of transmission. So only as transmission goes up do they place heavier and heavier restrictions on businesses. We do know that if you place no restrictions on businesses, you'll end up with a lot more in the way of transmission, of serious illness, of the healthcare system being overwhelmed, and of preventable death. So we're caught having to make these trade-off decisions.
All right. Thank you.
You're welcome.
Thank you, Sean. James Bowler from Cogeco, go ahead, please.
Thank you. Dr. Gardner, so when we're talking about possibly going into the red zone here, I've brought this up a few times to you before. Muskoka is again miles apart from where Simcoe is, especially Simcoe County and Simcoe South. When are we going to have a real conversation about partitioning these two areas? Because it really feels like that needs to happen.
I appreciate that, and I acknowledge that, in fact, the pattern of transmission in Muskoka is very different from Simcoe. For that matter, I've had the same question raised about North Simcoe versus South Simcoe. To deal with that question, we're now seeing a greater geographic dispersion of transmission and outbreaks working its way into northern Simcoe. So there's a potential for that to continue up to Muskoka, but we haven't had evidence of that yet. I have positioned that concern to the province and noted that if we end up with further restrictions, Muskoka will be impacted, even though they don't have the same transmission pattern. The counter consideration would be that there'd be added protection for Muskoka against such transmission from the south, but I think that argument hasn't been tried on neighboring health units that aren't so affected, so I think that carries limited weight. Another consideration is that legally the province may find it challenging to break up territories, though I don't think that would be impossible. But so far their approach has been to work with health units as a whole. We'll see if they change their position on that, but that's what they've positioned so far. I would acknowledge also that I've received communications from councils in municipalities in Muskoka making this case, as well as chambers of commerce. So there's certainly concern in Muskoka about being treated in the same way as Simcoe, even though their transmission pattern is very different.
Muskoka, and again, I think we've had this conversation that we're not really probably seeing the real numbers here. And I think part of that is that we have a lot of people that get sick here and go back to their own health units. Are we able to get kind of an updated look at that? Because we were able to get something from you in the early part of this pandemic, and I think it would be, helpful for people in the area to kind of know what the real numbers are.
So if you're asking, what's been the pattern of people who get tested but then leave, we've had limited information on that. And when asked, I've looked in it, it's been imperfect information because we're not routinely given the test results of people that live elsewhere that got tested here. We, by accident, might receive some of it, but what's required by law is the laboratories provide it to the health units in which they reside. So we don't routinely get all of that data. And other than that, we do have some breakdown on our website of the incidents per 100,000 population per week in Muskoka versus Simcoe. We've got also a breakdown of the percent positivity of the test results. We've got lower tier municipality data about the incidents in the preceding week. So we have a fair amount of data on our website that corroborates what you say, that there's a marked difference between Muskoka and Simcoe.
Sorry, just to follow up quickly, are you saying there's a possibility that there are people getting sick here and our health unit doesn't know know about that?
If they've been tested and then returned home, then the result would go to the health unit in which they reside. Now, if they've had contacts here, then that health unit would inform us of that and we would pursue those contacts.
Okay, thank you.
You're welcome.
Thanks, James. Matthew Riesler from News FM, go ahead, please. Matthew, are you on mute? Okay, makes the time for him to do the news. Do we have anyone from the Muskoka region? Or is there anyone else on the line we may have missed?
Hi, Kathy. I'm sorry, are you able to hear me now? Is that better?
Oh, yes. Okay, go ahead, Matthew, and then we'll get to Mark after that.
Sorry, Mark, I didn't mean to interrupt you there. MVP Norm Miller, he's been quoted as saying, Dr. Gardner, that he is in favor of separating Muskoka from Simcoe when it comes to the reporting of COVID numbers. What are your thoughts on that? Did you agree that Muskoka should be separated?
Well, certainly we get data that is specific to municipality in which people reside. So we have that information, and we actually provide quite a bit of analysis on our website that makes a distinction between Muskoka versus Simcoe. If he's referring further,
sorry, go ahead.
If he's referring further about then the application of the province's framework and the designation of the color coding, then as I've indicated, I've had some discussion at the province. So far their approach has been to treat health units as a whole, but I sympathize with the concern.
Yeah, he was speaking on the color coding of because Simcoe's numbers are higher than Muskoka's.
Yeah.
He was concerned that Muskoka being grouped in with Simcoe is problematic.
Yes, as I've indicated, I acknowledge that there's a marked difference in the data. I have communicated before with the province about this. There are challenges administratively in treating them separately. As a health unit, we would have to have two different domains on our website, one for Muskoka versus Simcoe about the regulations, and we'd have to be treating them both differently. So that would be a challenge for us to do, but I can certainly sympathize with businesses and how they'd be impacted, communities and how they would be impacted.
Okay, thank you.
You're welcome.
Thank you, Matthew. Mark Claremont from Muskoka Today, go ahead, please.
Thanks, Kathy and Matthew. Dr. Gardner, it sounds like you're coping well with confirmed cases, but I'm just wondering, what are you doing to proactively prevent the spread of the COVID and by relying primarily on local reporters to help you get the message out?
Well, we do rely on the media a great deal. I think the media plays an absolutely critical role in a functioning democracy to inform everybody about important things in their lives, including the pandemic, COVID-19. So I would never minimize the importance of the media, and we use the media. We depend on the media. We also use social media. We've been doing our own paid advertising social media campaign as well over the past 2 months, in particular targeting young adults, but general messaging as well. So that's the communication side. We certainly have a lot of one-on-one communication with people contacting us, which is perfect. We play an advisory role to people and to businesses. We otherwise enforce regulation, as well as the police and Bylaw and Ministry of Labor enforcing regulation in order to provide people a structure to abide by the practices that we need to be conforming with right now. Everything back to physical distancing, essentially, the infection control practices. So there's an enforcement piece to what we do that's important. And I can add to the requirements through orders or letters of instruction, which I've done on a number of occasions.
Thanks. Then why, regarding your social media strategy, are you relying on Facebook and Instagram, American companies, at the expense of supporting long-suffering Canadian and local media?
I've relied on the expertise of my communication personnel to advise as to what would be most effective.
Okay, just one final question. Today there were, of the 46 cases, 44 of them, by my account, were under investigation. Why is that?
We are challenged right now in how quickly we can get the information we need to enter the data and to be complete on all of that. So while we have a rapid response team that makes contact with the cases to make sure they're in isolation to avoid transmission, we are now delayed in being able to do the follow-up and thorough investigation and data entry just because of the volume. Doing what we can to increase our capacity, but that is our challenge.
Okay, thanks.
You're welcome.
Thanks, Mark. Is there anyone available from Muskoka Region on the line? Or anyone else we may have missed on the call?
Can I ask one more question regarding the person who died most recently? We've been told that perhaps it was indeed a person who died, but might not have been related to COVID. Are you able to confirm that it was a factor in his death?
All I can confirm is what I've already indicated. So a male, the age range, or a young adult, living in Simcoe County, and that individual had COVID-19. Other than that, I understand it's under investigation.
Thank you.
You're welcome.
Thank you, Erica. Okay, with that, we will bid you a good afternoon, and we will see you again next Tuesday. Bye-bye.
Bye-bye, everybody.